The coronavirus has been a cause for anxiety and disruption for everyone, but this especially goes for people who face health challenges on a daily basis. For people with disabilities, that means their own challenges, but also living with challenges faced by others, starting with providers of personal care. To tell us about the difficulties and adjustments is the director of the Boston Center for Independent Living, Bill Henning. Thank you very much for being with us, Bill.
Yeah, the crisis, as you said, Chris, impacts everyone. There is tremendous worry in the disability community because many people, not all people with disabilities, but many have a health concern and may be vulnerable, may have compromised immune systems or other conditions that would make them more susceptible to the virus. I would emphasize the state officials, city officials, Mayor Walsh, Governor Baker are doing a great job trying to get resources out to address something for which, as we've been saying, there is no playbook. But so I want that as a baseline context, but there are real challenges the disability community faces. People who get personal care services, and we help over 1,300 people get the services a year at BCIL. They have an attendant coming in who may help with activities of daily living, such as bathing, eating, toileting, getting out of bed. It's a real face-to-face, person-to-person contact. And unfortunately, there's a tremendous shortage of personal protection equipment. Everyone's calling it now PPE, but think in terms of masks, gloves, disinfectant wipes. We've appropriately heard of the crisis facing hospitals, but you have this acute shortage in home care services for people with disabilities, seniors, and we're really worried about transmission of the virus that way. We're advocating for PPE to get out to the consumers, to the PCAs. We're working closely with some city officials, the PCA union, 1199 SEIU, and it's just a basic shortage, but that is a prime concern because you may have people, not all who have respiratory issues, things like that. So the transmission, whether it's to the consumer or to the attendant, is a real possibility. And of course, you're trying to prevent this from happening. And I would also offer, we've heard throughout the state there have been real challenges in nursing homes. And clearly, when you're in a nursing home, you're usually in some kind of recovery from illness or injury, or you're just there maybe for the rest of your life. And all those folks are people with disabilities as well. You don't get in unless you have some kind of disabling condition. Even if we look at them as, say, a frail elder, they're actually people with disabilities. And it indicates vulnerabilities and why it's so important people have to social distance, because you could inadvertently transmit the virus, as we all know, to somebody who then goes to talk to one of their parents or siblings in a facility or wherever.
There's one problem that comes to my mind, and it could be at a nursing home or it could be just with one person with disabilities who depends on a personal care attendant, is that if you don't have enough testing, you don't know whether the person coming into contact with you has this virus. They might have a cough that's totally unrelated to it, or it might be related. Isn't that a scary thing to think about?
It is. 20 minutes before this interview, one of our board members who uses PCA sent me an email. Do you know anything about getting masks? Every time I cough, every time my nose runs, I'm petrified I will be now with the virus. And he goes, am I paranoid? And I go, no, you're being smart, you're being safe. It's a natural thing we all take into account, but he's a quadriplegic and would be very vulnerable if with this nasty, dreadful virus. So it is a real concern. I will give the state Mass Health credit. They, if say an attendant believes they're sick or something, they're supposed to excuse themselves, and the state's trying to set up alternative means of care. One of the concerns you would have if your attendant can't come in, you could develop bed sores, UTIs, urinary tract infections, other problems. So, and people even use attendants, to enhance their independence. Lots of people use them to go to work, but they do things, like I said, help with meal preparation or feeding somebody. So then eating could even decline. So this is a real concern. Officials are aware of it. I wouldn't even suggest for a millisecond that they aren't. It's just dealing with this flood of things all at once. You know, the tragedies in nursing homes, the potential overload of, well, not the potential, the real overload right now of intensive care units and all these adjunct facilities being set up, the worry about adequate number of ventilators, things like that. And these are folks, you know, the rate of disability in the community is about 20% of the population. So we're all going to know somebody impacted by this, especially over the coming weeks when this so-called surge happens.
What about access to medical care? Because sometimes this does involve things that you have to go out to at another location. Are people able to get those services? Can it do it through online connections now? What's it like?
We have been surveying and questioning our members. We posted an online survey. We've been calling people. We haven't heard that concern. I have to go back and review a new batch of surveys that came in. We are monitoring it because what may be a routine procedure for some people might be a very needed procedure or check-in for somebody else. And we don't want secondary conditions to develop, you know, but I haven't heard it's a concern. I think the challenges are people have to get to medical appointments by, you know, means of public transportation, which has some risks. And of course, you're going into hospitals where just the overload is exponential at this point.
Well, one of the things you do with your organization, and it's maybe your main mission, is you help people achieve and maintain a sense of autonomy. How has that been affected by this epidemic? That mindset.
A lot of the, I think a lot of, yeah, everyone's autonomy is a little bit down. We're, you know, if we're adhering to the rules, we're not going places. This interview is conducted from a bedroom in my home. But, you know, if you have some level of dependency that almost was subtle and you didn't even think of it, you went out to a congregate meal site, maybe you went shopping and now you can't do it because there's limited transportation or you're more fearful of exposure, those kinds of things. The autonomy is really clipped. Maybe you were working and now, of course, you've been laid off like masses of people. It's going to be in significant and subtle ways where I think the community of people with disabilities have their independence curtailed. And isolation is a real concern, especially for lots of people who are missing the social interaction, and it's key to mental health as well.
I do want to take this to one higher level, though, and this is in the worst possible scenarios. We have these guidelines from the state now about which patients would get the intensive care if it has to be rationed. How is that filtering among people with disabilities?
BCIL has been talking with disability advocates, as it is some from around the country, and we've been part of some submissions to healthcare officials and state officials on being sure there's no discrimination against people with disabilities overtly. But if equipment's rationed, we're worried about a couple of things. One of the things would be that you know, any innate biases or prejudices on value of someone's life gets taken into play, and people with disabilities have the same quality of life as many people. Though, you know, if somebody gets injured, you say, oh, what are they going to do with the rest of their life? Most people with disabilities have vital lives. It may not be the same as a non-disabled person, but it's vital. So you worry that that gets taken into consideration. They use a medical term, comorbidities. So does the person have a secondary or tertiary health condition? They may very well have such a situation. You know, there's talk of that those things get taken into consideration on who gets allocated the care. But, you know, many people with disabilities live decades with secondary conditions, secondary comorbidities, as it's called. and have vital lives, and you don't want those things taken into the picture. It's kind of like, you know, we've seen stories on disparities around race and ethnicity, and it's the same for people with disabilities. So, you know, the state can be brilliant medical ethicists, but we're, you know, and is attuned to listening to people with disabilities, always have been, but it's really going to play out in the individual facilities. We've been contacting some of the local hospitals, not all of them, to share some of the documents that are out there as well. We think this could be a real pivotal issue.